Welcome to our office hours. We're just going to wait a couple more seconds. Just let everybody come on in and join in. So while we're waiting for everyone, looks like everything's working well. We're grooving. I'm going to go ahead and introduce who we are. So my name is Alex Ruiz. I am the Director of Marketing here at Paloma Health. And in case you don't know who we are at Paloma, we are an online medical practice who specializes in treating hypothyroidism and Hashimoto's. We have a mobile app that's completely free, tons of resources, blogs, workouts, guided meditations, recipes, so many resources to really help support you on your hormone and thyroid journey. But as I mentioned, we are an online medical practice, which means that we have providers like our special guest today, Teresa Peña, who's going to be answering all of your questions. And she's one of our providers here at Paloma, who you can see virtually. So that means from the comfort of your own home. And we can do everything as far as, fill medication, submit medication refills. We also accept insurances, depending on your state and coverage. So you can work with our clinical team to get that all through your insurance and everything. So with that being said, we are so excited to have you here for our office hours. This is a monthly segment where we have our experts like Dr. Peña answer all of your questions without needing an appointment. So without further ado, I'm going to go ahead and pass the mic to Dr. Peña, and we'll get started.
All right, Alex, thanks. All right, and this is fun to be here, by the way. And it's Tuesday, which in my head is like, okay, so the Monday's over. They're just the hardest day. Tomorrow's hump day, and then it's Friday Eve. So, the week's almost over. At least that's my perspective. All right, so I'm told there are a number of questions. And so let's just get started on that. Okay. Let's see. The first question has to do with Ozempic, or semaglutide is the generic name. And the question or the FDA warning about thyroid and thyroid tumors, does it mean that Ozempic is off the table for people with Hashimoto's and hypothyroidism? Well, I actually looked up the research connecting thyroid issues and with the GLP-1 agonists. And as far as I can tell, and I guess I would have to research more to conclude, but what I was able to do, the research was done in rats. So it's not humans. And so we're extrapolating. It's a issue of concern. It's an issue of awareness, but the benefits, does it exclude? No, not in my mind. I have a number of patients who are on GLP-1 agonists, as well as treatment for their Hashimoto's thyroiditis. And the idea of lowering your body fat and lowering your weight to get in a better metabolic profile far outweighs, in my head, risks that might be ahead that are theoretical. So we could always talk about the GLP-1s and how they're used and how I use them, but are they contraindicated? Not in my head. I use them if they're needed. They're a tool. They're not an answer. They're a tool. Okay, vegan carnivore diet. 2 weeks ago, quickly gained 10 pounds in that 2 weeks. Oh, sorry. Doctors in the carnivore community say that weight increase is normal and your body's adjusting to fat as fuel. They recommend 80% fat and 20% meat. Can't deal with the weight gain. And I don't know what to do. My plan is to go carnivore and reverse thyroid issues altogether. Is that wishful thinking? Well, we could always wish. And I actually don't know any studies about thyroid and carnivore directly. So I'm just going to theorize out loud. I tell my patients who I work with, I talk out loud so they can kind of get insights to my brain and learn. Ultimately, that's my goal. So carnivore diet, you're eating 20% meat, 80% fat. That is a choice. I'm not sure about the long-term health issues because you're taking a lot of vegetables that our body has evolved to use for the micronutrients and the phytochemicals that are in there. And so you're depriving your body of that. With that deprivation, you are asking your body to work harder than it needs to, in my opinion. So is that sustainable? It's a choice. We could always force our body to do whatever we want, but it isn't ideal. I don't know that I would suggest that as a methodology to treat your thyroid. And yet, it's not short term. I don't think it's all that harmful. So approach it as an experiment. Do it for X amount of weeks. Know what's going into what you're looking for. Lab test, feeling, sensation, whatever, biomarkers. Do it for X amount of weeks. My suggestion is 4 to 6. Retest those markers and see if there's the change. Look what improved. Look for what did not improve, because everything will have an upside and a downside. So that's my suggestion there. I have Hashimoto's on levothyroxine. How can I increase my T3 and have my levels optimized? So if I'm inferring that right, that means your free T4 is okay. It's just the conversion of that free T4 to free T3. When that's the issue, I often point to, or at least work on optimizing nutritional issues and oxidative stress. Nutritional issues. What am I going to look for? I'm going to look for iron stores. I'm going to look for ferritin, because I shouldn't be surprised, but a number of people cross my world and their ferritin is not elevated or at optimal levels, which it needs to be to have all your thyroid work. So we have the iron, we have the ferritin, we have the vitamin D. Very important to have that not only for your thyroid, but for your immune system. We have your Bs, we have your zinc, selenium, iodine. I do a CBC and a comprehensive metabolic panel to make sure that those are functioning okay. So I'm looking for nutrition. And I'm always will suggest to Hashimoto's patients that they support their thyroid to work its best with a nutritional supplement. Now, Paloma has one, but the key ingredients are zinc, selenium, tyrosine, which is the precursor to thyroid hormone molecule, and the methylated B vitamins. What do I mean by methylated? Those B vitamins are the same chemical composition that are used in our body. They're not synthetic vitamins. And so using that can help give the thyroid what it needs. And to lower the oxidative stress, I would suggest a second supplement called N-acetylcysteine, or NAC. And that's at typical 500 to 600 milligram capsules. You take 2 of them twice a day for at least 3 months to lower that oxidative stress. We all have oxidative stress, but if we can lower the burden, then our body just works that much better. So nutritionally, I really look for that as my mainstay to get conversion of T4 to T3 improved. Can LDN decrease antibodies and inflammation? Absolutely. That is the goal of low-dose naltrexone, or LDN. Low-dose naltrexone is used at 1 milligram up to 4 or 5 milligrams, taken before bedtime to balance what we call the T1, T2 balance in the immune system. And as I tell my patient, all it does is it make your immune system less irritable, less twitchy. So it doesn't make your immune system less. It still can respond to colds and stuff, but it just chills it out a little bit. So then your numbers come down, inflammation comes down, and you feel overall a lot better. That is something I have used in my Hashimoto's patients that are struggling, and we've optimized everything we can. Oftentimes I'll pull out LDN and see if that can't get somebody's quality of life to improve. But yeah, LDN, I love it. Let's see. Since T3 is more active thyroid, correct, 4 times, by the way, than T4, why are physicians so reluctant to prescribe it? Why are physicians apparently okay to prescribe too high a dose of T4? I don't know the reluctance. When new patients come to me, often they're on Cytomel, which is the synthetic T3. And I'm not sure what the prescribed too high of T4 dosage means. So when I look at somebody's labs, first of all, I'm going to ground them to how they're feeling, but I'm going to look at their labs, and I'm going to look at 3 key ones at a bare minimum: TSH, free T4, free T3. The TSH needs to be detectable, and so it can't be suppressed. I'm not a physician that supports suppressed thyroid, because our TSH receptors go beyond the thyroid into our brain, our heart, and our bones at the beginning, but they're all over our body. They're there for a reason. I'm not going to mess up whatever it is with that. So I'm not going to suppress. So I want my TSH. Target goal 1.5 to 2. Free T4, 1.0 to 1.2. Free T3, 3.0 to 3.4, somewhere around in there, a combination to get to those goals. The idea of getting the T4 is be higher, if that's what it is to get that conversion to free T3. We want that free T3. That's what goes in the cell. That's what is most connected to those symptoms of having a good metabolic rate, having a good thyroid function, is that free T3. And so doctors will often add synthetic T3, or Cytomel is a brand name, to see if they can't raise that while keeping the free T4 and the TSH roughly the same. That can work with a number of my patients. It can work. And you take it at the same time you take your T4. So the T4 gets converted to T3, as you probably already know, and that free T3 goes into the cell. The challenge with Cytomel or free T3, when given that way, is that you get a burst of energy and then it goes away. The thought behind that was T4 then has that continuous release of free T3, that conversion, I should say, to T3 and then free T3. And so you get that. So it's often a bit of, it's definitely medicine, and it's a large part of art. And the art comes in because of everything being connected to everything. So when I look at a thyroid, I'm not looking just at the hormones of the thyroid. I'm looking at, gosh, what else is going on? How is their gut? How is the stress? How is the, do I have adrenal issues? Do I have perimenopause, menopausal issues? Do I have insulin resistance? Do I have frank diabetes? Do I have inflammation? Everything else. All of those things will affect the thyroid. The thyroid is a dynamic gland. It's there to regulate our metabolic rate. So if the body thinks it's under threat, if it says, I'm not sure I am going to have enough energy, it's going to tell the thyroid, dial it down. Don't spend so much energy. If there is a reason like we need more energy, it will dial it up. The TSH has a diurnal rhythm, which means it has a pattern to the day. So I always ask my patients to take their labs first thing in the morning without their medication, so I have a baseline. So we minimize the variability. So it depends on how you're working with, what your goal. So hopefully that answered the question. I'm not sure it did, but there you go. You can follow up if with another follow-up question for that. All right. In my professional opinion, what is the most direct and rapid approach to feeling human when levothyroxine hasn't touched the extreme fatigue, weight gain without cause, and no libido? Well, I need qualifying questions. How old you are? What's your other hormone state? What is the other metabolic issues or things going on? Do you have depression, anxiety, trauma? What, all of these things cross my mind when I'm working with somebody. Again, it isn't just the axis of thyroid, but given the levothyroxine, if somebody is not feeling very good on that, my thought is to trial natural desiccated thyroid as a way to get you to feel better, which a lot of my Hashimoto's patients end up on natural desiccated thyroid because they feel so much better on it than T4. My TSH levels fluctuate. I do realize primary physicians see Hashimoto's as a disorder that only best treated by monitoring TSH and fluctuate dose in hopes to easing the symptoms. Recently, I had my antibodies checked on my own, and TPO was 0, but my anti-thyroid globulin was high. Endocrinologist has yet to explain this rare Hashimoto's results. When I used to check anti-TG and TPO antibodies, I would come across the TPO being low and thyroid globulin being moderately elevated. So fluctuations with the TSH. As I just mentioned, there's a daily rhythm to the TSH. So again, I ask my patients to do it first thing in the morning. Don't take your medication because your medication will affect the TSH. I want to know what your baseline is. So that fluctuation may be in part because of how it was drawn, how it was taken, and the situation around it. So that's my first thought. And then the antithyroid globulin still says to me that your immune system is active against your thyroid. And when a Hashimoto's patient comes to me, I explain to them they have two things going on. They have their thyroid not working really well, and they have an immune system that's not happy. Both of those need to be taken in consideration about recommendations and treatments. All right. My question, how can we find balance? Oh, okay. Do thyroid supplements help someone like me with no thyroid at all due to radioactive iodine therapy? My cholesterol is 265 and the rest of the other panel tests are all high. Okay, how do I find balance? Well, my first question is, what do you mean by balance? So do the thyroid supplements help someone like you with no thyroid? I would say yes, because there are things in that whole thyroid hormone axis that occur outside the thyroid. And those micronutrients are going to be vital. The vitamin D is not only functions for your thyroid hormonal axis, but it's an immune system issue as well as a lot of different other things. So those micronutrients aren't just limited to the thyroid. They're going to be used throughout the entire body. So yes, those supplements will help you just feel better as a more of a holistic approach than just a specific thyroid one. And without knowing your numbers, it's hard to comment about what to do and stuff like that. Just because you don't have a thyroid does not mean we don't pay attention to your TSH. Just had a conversation with that. And because, again, as I mentioned earlier, if you didn't catch it, the TSH receptor is all over the body, heart, bone, brain, other tissues. There's a number that needs to be paid attention to. Hypothyroid medications affect my sleep quality drastically. Can you suggest prescription non-habit forming sleep medication? Well, I'm the Colby, a fact finder. So I'm always curious about, well, what do you mean by that? All these other things. So that's what went through my head as I read your question. So I'm not sure what you mean by the effect of sleep. So that is interesting, because then my question goes, is it a side effect to the particular medication? Is it the medication's not working with your physiology really well? Do you have other hidden issues that aren't being connected to the sleep and somehow they are to the thyroid? So actually diving into what does it mean that your sleep quality is that poor? And so for sleep specifically, to answer your question, I support sleep in a couple of different ways. One is with L-theanine. That is a supplement that supports GABA. That GABA is the neurotransmitters that calm down the brain. So that's one of the supplements I use is L-theanine. The other one is magnesium citrate. And that is the most absorbable magnesium. So that gets into the body, and that just, again, sort of relaxes the body, the muscles. And then Magtein, Magtein, it's a trade name of a magnesium formulation that crosses the blood-brain barrier. And I want the magnesium in the brain so it could work its best. And also, most of us are magnesium depleted, or at least running on low levels. So again, I want to optimize that brain so it can go into its function that it needs to in the circadian rhythm. And I want the body to be chilled. So those are 2 or 3 supplements I use for sleep optimization. Okay, so next, I was recently treated for iron deficiency and my TSH went up to 18 and my T4, T3 crashed. Is this normal? It was like I wasn't on any thyroid medication at all. I took the liquid iron greater than 4 hours away from my morning thyroid med. Good point, because if you take iron, it's going to interfere with your thyroid medication, the absorption of it. That's interesting. I'm not sure. I'd have to do a little reading on that and research about why your TSH went up to 18. That's a puzzle. I bet your provider also thought it was a bit of a puzzle. Hopefully all that's resolved and you're feeling better. Let's see. Diagnosed with hypothyroidism, and then a while later you're having more symptoms of hyperthyroidism than hypo. I have symptoms that match both, but can you actually change from one to the other? If you are over medicated, if you are taking Cytomel, if you are taking the medication at the wrong time, yes, you can feel that it's both low and high. The other thing I've seen is that if you're taking too much medication, you have both symptoms or it feels like you don't have enough. So if the body is seeing I have too much medication on board, it's going to tell the system, don't make as much. It's going to tell the thyroid to go down. So we'll see the TSH drop. We also will see the T4 and the T3 drop accordingly because there's so much on it that the body's not going to make more if there's a lot on it. With that lower T4, T3 dose, you're going to feel like you don't have enough thyroid medication on board. So I've seen the myriad of symptoms when the labs are not optimal. So it's not as black and white as we want it to be. Check, check, check. Oh, I have low thyroid. Check, check. I have high thyroid. It's not that simple. You have to take things in context and bring in labs, bring in how you're feeling and work from there. Oh, okay. You suffer from panic attacks. Is this common? Anything to suggest for help? Well, yeah, there are, number one, seeking out help. I'm sure there's a number of online resources for you. I don't know if Alex or if somebody can find something to reach out there. Panic attacks are not unusual at all. People have panic attacks. And I would strongly suggest connecting with a provider who knows how to evaluate them from a medical point of view, as well as helping you work through the cause of them and then help ameliorate your symptoms when you do have it. They are really uncomfortable and awful to live through. So please seek some help out there for that. You don't need to suffer with those at all. Can I talk about Hashimoto's flare-ups? Still learning about this disease since I was diagnosed with it. I experienced anxiety mixed with being skittish and jumpy during a flare. Totally understand that. So a flare says the antibodies now are allowing your thyroid to suddenly release a whole lot of hormone. Now you have a surge of that hormone. It's got to go through its process. So you have a surge of all of these hitting your system. I was just talking to somebody today about how do you know you have too much replacement medication on board? I tell them you look anxious, you drank 5, 10 cappuccinos all at once, anxiety, sleep disturbance, heart palpitations, all of the things, jumpy, skittish. Yeah. That in that flare, your body's experiencing a high number of hormones. So that's how it reacts. Hopefully you're working on calming your Hashimoto's. And so the flares go away, number one, and that you don't experience that again. That's really uncomfortable. Sorry that you're experiencing that. Okay. March start to AIP. Yay! And I've been conflicting information about citrus foods. Are they AIP compliant? Oh, you hit on one of my things that I'm not that good on, and it's the nuances of nutritional recommendations. Hence, that's why I bring specialists in my back pocket. You probably should connect with a nutritionist about that to get accurate information. But I will comment that everybody's a little different and that it might be just one of those experiments, that you need to go through. So if somebody tells you that it is a problem and another one doesn't, well, for you, we don't know that answer. So citrus, take it away in the AIP, reintroduce it, and again, ground yourself to your body's response so you know how you respond to it, not what somebody else told you you should or shouldn't. Knowing you and knowing your body's physiological responses to food is a skill development, and it will serve you now and it will serve you in the future. So good for you for starting the AIP. Relationship between dietary histamine intake and the progression of Hashimoto's. The direct link? I'd have to do some reading and research on that. I don't know. Histamine is a challenge for those people who have histamine issues. And it can feel like your Hashimoto's flared up because of the agitation, the heart rate, all of those things. So it's not a great combo. And I'm sorry if you're struggling with histamine, that could be hard. Noticing I have a few distinctive blue spots on the bottom lip that change in color in time. Changes in color tone, sorry. When I feel very tired or low energy, the blue spots become more noticeable. When I feel normal, fine, they're not as visible. This is related to hypothyroid symptoms or leaf levels. Without knowing exactly what that is on the lip, I'm guessing it's a vessel, but you're gonna have to have somebody professionally look at that and give you advice, let alone be able to connect it to your thyroid state. Can I talk about vestibular problems, vertigo, and dizziness? Does my hypothyroidism make it worse, trigger it? I can see a case where hypothyroidism can make vertigo worse, in that if your thyroid is not as resilient, or it's out of control or not balanced, that would affect your adrenals, and that adrenals would definitely affect your ability to have dizziness, how strong that is and not, especially positional changes, meaning from standing up, from sitting or lying down. And the vertigo and dizziness can be so hard to land on a cause. So if you're in the middle of a workup, have patience. Most of the time it's benign, but do go through the workup and make sure that you just need some physical therapy to get your vestibular system back online, which is the most common reason why, and PT works wonderful for things like that. All right. I changed from compounded armor to non-compounded armor. With 2 weeks, my hair started falling. Should I go back to compounding? My thyroid levels show normal. If you did better on the compounded, then I would go back. So just from that comment itself, I would say within that 2 week, it could be the non-compounded armor. And so I would have a low threshold to getting back to the previous one in which you did so well. So I like my hair, so I would do almost anything to keep it. So I would go back to the armor. That's my off-the-cuff suggestion.
Awesome. Thank you so much, Dr. Peña. Guys, that was our office hours, our June office hours. Thank you so much for attending. If we didn't get to your question, which I think we got through every single question, but if we did not get to your question, we have office hours every single month with one of our providers. So join us. Actually, next month is going to be our first edition of our nutrition edition office hours. So our registered dietitian, Nicole, will be joining us. So any dietary questions that you have in terms of AIP compliance, carnivore diets, for example, I see sometimes in our communities, we have people who are vegan that need help with supplementing. Whatever the case may be, this is your event to attend and ask those questions. So make sure to join us next month. And as I mentioned, Dr. Peña is one of our providers. So if you would like to see her, all you got to do is go to our website, palomahealth.com, become a member. And then if she's available in your state, you could book an appointment potentially as early as this week, depending on her availability. I know that she's seeing patients later today, and she saw some earlier this morning. So busy lady. Well, with all that being said, thank you guys so much for joining. We appreciate your time, for being here. And again, check out our resources both on our website, palomahealth.com, and the free mobile app that you can download. Lots of guided meditations, recipes, workouts, all the things for you to enjoy. You can even track your symptoms, which is a really big aspect of our mobile app. That's really great. And yeah, thank you guys for joining. We will see you next time.